In a textbook normal spinal column, spongy discs hold each of your vertebrae apart. Over time, and for various reasons, a disc can degenerate, causing the nucleus of the disc to bulge outwards, sometimes pinching a nerve. As degeneration continues, the bones spur outward with sharp edges, causing even more discomfort. In addition, the weight shifts from the center of the disc to the joint facets in the back of the spine. These are very pain-sensitive. Towards the final phase of this painful downward cycle, the disc is almost completely deteriorated. Surgery is not the only option. Strengthening and rebuilding is what you need. Dr. Alan Unruh's newest technique can help your back heal and feel better. The Unruh Chiropractic Center is one of the unique clinics that is dedicated to the highest quality of care, utilizing the latest in technology, such as the flexion distraction table. This allows Dr. Unruh to treat the most complicated disc and spine injuries effectively, avoiding most spine surgeries and/or repeat surgeries. People with previous back surgeries don't have to learn to live with it. Dr. Unruh has seen patients who have had up to 7 previous back surgeries and multiple spinal fusions. The gentle distraction procedures are very safe, and Dr. Unruh has a good working relationship with other medical professionals to give the best care to his patients.
There's nothing invasive to the body. We're working with the body's ability to heal itself. And your body has miraculous healing ability to do just that. When a patient lays on this table, the table actually gets longer. We can move the spine in up to 12 different positions. So we're actually decompressing the disc, and it creates a vacuum inside the disc. And this suction actually pulls the nucleus that's swollen up against nerves back to its neutral position. We're actually working with your muscles, working with the ligaments, working with the joints, restoring mechanical function back to the spine. We're strengthening the spine, stretching the spine, improving the circulation, oxygen, nutrition, lubricating fluid and synovial fluid. That's so important to proper function of the spine.
Dr. Alan Unruh goes the extra mile to make sure you're taken care of, even after you leave the office.
We give home exercises. We teach you how to do the exercises at home to help you recover faster. We give nutritional support. Nutrition is a very important part to give the proper nutrients to the disc with calcium, magnesium, and chondroitin sulfate and certain types of enzymes that help to get rid of inflammation that are natural without side effects. We teach you proper ergonomics and proper posture, proper sleeping habits. We have specialized rehab that we can monitor where we're actually supervising how your spine is strengthening to work for maximum recovery. So everything we do is natural, and it's not invasive, it's effective, and it's safe, and it feels great.
Well, check it out. Sioux Falls, South Dakota. Yeah, 2 blocks south of the arena. Western and Burnside. A Unruh Chiropractic Clinic. Yeah.
This is Dr. Unruh again, and today we're talking about the miracle of chiropractic. And we have a saying in our office, expect a miracle, because miraculous things can occur inside the body when we work with the natural recuperative powers of the human body. And today we have a guest, Doug Pottebaum, going to be explaining his story about how chiropractic has helped him with his chronic back problem.
The spinal stenosis, it just come on gradual over time. I didn't even notice that I was starting to walk a little funny, but the icing on the cake was February 19th when we were down in Tulsa, Oklahoma. I was getting out of the shower, and I hit the linoleum, and I slipped, and I went down and got stuck between the door and the stool and the wall, and I tipped my pelvis and ruptured a disc. The pain was a sharpness, burning down in the lower back, and my right leg was numb, tingly, all the way down to my toes. It just hurt too bad to walk. I would sit in a recliner. The best I could do was go from the recliner to the kitchen table, which was probably 15, 20 feet. Bathroom, probably another 10, 15 feet. And that's all the further I could go without being just totally exhausted. I would get back to the recliner, and that's where I'd sleep at night, because there's no way I could even lay down on my stomach or my back flat at all. And that's when I went and seen a doctor, and he tried a few things, and they did x-rays, MRIs, whatever, and he tried different muscle relaxants, and nothing would work. And finally they said surgery is the only option. When I come into Doc Unruh's office, I was expecting just to be put down on a table and have your bones cracked and nudged here and there, and it wasn't anything like that.
That's not a minor problem, severe stenosis. And so I said, well, what have we got to lose by trying distraction to see if it'll relieve your condition? And he got enough relief the first visit to cancel his surgery. I think it was after 5 visits, you could stand up straight.
3 visits.
3 visits, he was standing up straight.
The 3rd visit, I was standing up straight. I walked out of there. When I come home and went up the front steps, my wife couldn't believe how I was walking.
People in church noticed how you walked?
Yes, they did. A new person.
Isn't that something?
After watching me for 3.5 months, walking humped over like the Hunchback of Notre Dame.
It's amazing how not only did you get relief care, but you got corrective care. You followed through the rehab program. His flexibility came to completely normal. So the important thing is, Doug did come in, and he responded even after months of suffering. And there's millions of people, and tens of thousands in this region, that are suffering for days, weeks, and months, and sometimes years, not realizing that the healing power is inside of them. It just needs to be released. All drugs have side effects, and anti-inflammatories, they can accumulate. They're necessary sometimes when a person has severe pain, but they should never be used for long-term use of chronic back pain because they affect the stomach, liver, kidneys, and now even research shows they can cause a heart attack. So you don't want to start living on long-term on that type of treatment program. So the question is, what can you do naturally to help your body recover? Your body can produce miracles. In fact, our policy is a miracle a day.
One of Dr. Alan Unruh's newest pain relief instruments is the Aqua Massage Bed. It's like a heat treatment, a whirlpool, and a massage all in one. Just one session on this bed can lower blood pressure, remove toxins from your body, and encourage the release of endorphins, which are your body's natural painkillers. Doug Potabaum used the Aqua Massage in addition to the rest of his treatment, and, well, let's hear about it from him.
The Aqua Bed was really relaxing. When I got in there, at first I kind of looked at it and like, why are they putting me in here? But they laid me down on that, and it was just, it's a different experience. The soothing music, the massaging from the neck to your ankles, and there was times where the 15 minutes was up, and they'd have to about wake you up. They really actually have to about help you out because you are so relaxed. It just feels so good.
I had a scoliosis spinal fusion when I was young. They fused 17 vertebrae. I spent 1.5 years in a body cast. And I was really a miracle kid. I was the single most successful surgery of my kind. to come out of Shriners Crippled Children's Hospitals. And I did fairly well for many years. And I got into a car accident, and I had lingering effects from that car accident with my neck, which got progressively worse until it became debilitating. I was having to constantly lay down. I had headaches that would just drive me to my knees. I had pain in my shoulder, down my arm, nerve problems in my face. I could turn my head maybe this far. I couldn't bring my head down or back. I couldn't work full-time, and even working part-time, I found myself having to lay down at work. I don't know how to describe to you what it's like living like that. Taking pain pills every day, all day, not being able to sleep, being in constant pain. My husband, my family were totally affected. I couldn't function at home, at work. I went to go see 2 different surgeons. One doctor felt that surgery would be the only relief I would get. The other one thought it was a dangerous option because I do have so many vertebrae fused. The reports they gave me were very conflicted. I've had a lot of surgery on my back, and more surgery on my back did not appeal to me, but I couldn't live the way I was living because I just basically wasn't functioning. I ran into another woman who has scoliosis, and she told me that Dr. Unruh had helped her quite a bit, and that I should go in and talk to him. So when I came into his office, I was basically disabled.
Well, when Kyra came in, obviously she's a very complicated case, and it's not a textbook case. We learn a lot about different diagnoses and textbook cases in school, but the real textbook cases are not the ones that always walk in our office. And with the new technology, with the distraction instrument, I thought Kyra would be a perfect candidate for this type of care. So we always adjust our treatment to the patient, not the patient to the treatment. So we only work with what's tolerable to the patient. We explain our treatment would be very gentle. We're only going to work with what she feels comfortable with. And then each visit we would try to increase that range of motion a little bit more.
I came into the office about 2 weeks, maybe 3, after I started treatment with him. And I walked up to his nurse and I said, "Ask me what my pain level is. Ask me, ask me." And she goes, "Okay, what's your pain level?" And I went, "0." And she went, "You're kidding me." And I went, "No, it's 0." You know, and I was just, I mean, you have no idea. I was ecstatic. I hadn't been pain-free in over a year. I am going to be eternally grateful because I am well. And I have my life back. And if it wasn't for Dr. Unruh, I honestly don't know where I'd be right now. But I don't think I'd be well, working full-time, raising a grandson, riding my motorcycle, volunteering at my church. I wasn't able to do any of that. I have my life back because of Dr. Unruh's chiropractic care.
98% of our people show excellent progress within a short period of time, and the people who've discovered the benefits never would go back to another form of care. A lot of people come once a month, every other month, just for an adjustment because it keeps them feeling great year-round. It's kind of like rotating your tires and changing the oil in your car. A little maintenance goes a long way in the longevity of your vehicle. Well, it's the same with your spine. A little bit of maintenance, a little bit of exercise on a regular basis, the periodic manipulation will keep your spine healthy, will keep the joints from degenerating.
It all starts with just sitting down with one of the courteous staff members at the Unruh Chiropractic Clinic and telling your story. Dr. Alan Unruh makes miracles happen every day. Visit draunruh.com or call 605-332-1962 and tell us what hurts. Dr. Alan Unruh can give you back the freedom to live, the freedom to work, and the freedom to move.